Well, one of the hottest issues on tomorrow's ballot is Prop 45. It'll give the insurance commissioner the power to veto health insurance rates that he thinks are too steep. In the last field poll before the election, support for 45 had dropped to 30%. The no votes had jumped to 42%, with 28% still undecided. Compare that to this summer, when support was at 69%. No votes were 16% and 15% were undecided. Alan is here to talk a little bit more about what's become a very expensive fight and why those poll numbers have changed so dramatically.
Dramatic it is. All right, undoubtedly, a reason for that change in the poll numbers is advertising. And the advertising has been relentless. You probably know that. And the one thing that fuels ads? The money.
Put the brakes on rates.
Those endorsing Prop 45? Consumer advocates, trial lawyers, the state insurance commissioner, and some in the Democratic Party. On the no side,
giving one Sacramento politician the power to override the commission.
Health insurance companies, doctors, and a powerful Democrat.
Join Nancy Pelosi and healthcare groups across California.
Under Prop 45, the state health insurance commissioner would have the power to deny health insurance rate increases that he or she decides are too exorbitant. It's the same authority that exists in 35 other states, and the same power that Prop 103 gave the California commissioner over auto and property insurance. Using street art to promote Prop 45 in San Francisco, backers refute the opponent's claim the insurance commissioner would have too much power.
Well, I think if you ask Californians who they think has too much power over their health care, they're going to say it's the health insurance companies.
Dr. John Ma, a San Francisco surgeon and Prop 45 opponent, agrees with what most major newspapers in the state have said. Prop 45 would interfere with the Affordable Health Care Act, which he believes will make coverage more competitive.
It's transparency in pricing, it's competition, and I think that's what Covered California has begun, but much more work yet remains. And to those individuals who are very concerned about their insurance premiums increasing, I understand, and I would ask them to be patient.
Yet the money being spent on this issue has become an issue itself. At last count, $57 million has gone to the No campaign, with more than $45 million from two of the largest health insurance companies and Kaiser.
As a consumer, you have to look at this and think, what are they so afraid of? What is going to happen in their estimation that warrants this kind of extraordinary expense to defeat this measure?
Prop 45 would only apply to about 6 million Californians, those who buy their own health insurance or they get it through a small employer. It does not apply to large employer plans or people on Medicare or Medi-Cal either.